So thank you for joining me today for this webinar on partition survival analysis. This is a relatively new feature to us, but it's not a new modeling technique. It's been used for a very long time, especially in the area of oncology. And I think the easiest way to kind of discuss this is to look at a model. So we'll first look at a model at a more kind of overview level, and then we'll dig into the details underneath that model after that. So let me switch over to TreeAge Pro. And here is a model that you can look at. This model is part of the example models that you'll see in the files view. So all these, there's a bunch of different partition survival analysis models that you can use. I'll just close this for now because we're looking at this part as a example model, and we're looking at also looking at the survival curves generated from that, the survival curve graph. So let's talk about what we have here. So partition survival analysis is a modeling technique that allows you to map your model's disease progression directly to observed data. So presumably you have some kind of clinical trial set or some set of hospital data that describes when people have progressed, in this case, in this model, progressed and when they've died. And you have that collection of individual patients' data, and now you can use that to say, well, let's assume that the whole cohort of anyone that has this disease follows the same kind of pathways that those individuals that you have data for have passed. And the advantage over that is you're feeding it right to that data, as opposed to in a Markov model, you have to come up with a lot of transition probabilities to mimic that transition or those progression rates. So there's advantage and disadvantage, which we'll talk about shortly. So here's our part A example model. And you see it's very simple, right? It's just a part A node and then two branches, which we call survival curve nodes, and they're just terminal nodes. So the structure is very simple. Now, what goes into these details is not quite so simple, and we'll have to spend a little time on that. So here it is, and so it loosely represents a Markov model, where this would be a Markov node, and then these would be health states, and these are still loosely health states. But in a Markov model, this would be a chance node, and you'd have events that would continue to drive how people moved amongst the states. So this structure would extend, and you'd have branches for progress or don't progress, and the probabilities under that would drive the patients to different split amongst the states, and you'd use that to derive disease progression. Whereas in a partition survival analysis or a partition survival model, you have these survival functions which define how the disease progresses. Now let's talk a little bit deeper about that. So what do these represent? Well, these come from data that you collected. So when you're talking about the progression-free survival, you've collected data in terms of when did people progress, and we fitted a curve to that. Now, we didn't do that within the software, but assume you used R or SAS or Stata to perform regression analysis on that data, and we derived a distribution that we thought best fit to that those progression events. And so that becomes a delineation. The survival curve here becomes delineation between when people moved from a progression-free state to some other state. Now, it doesn't directly imply they went, it's not quite so clear when people die. People could die directly from here, but this is derived from progressions among your patients. Now, the details are a little deeper, but I don't want to get too deep in that yet. So you've collected your data about progressions, you've fitted to a curve, and you've entered the curve in here. And now this survival curve node represents this survival curve in the represented graphically, and this area below this curve represents membership in the progression-free state. So at time 0, everyone's in the progression-free state. By the time you get to year 6, this is an annual model, right? You're down to whatever this is, about 28% are still progression-free. And obviously that's going to drop with time. By the time you get out to 30 years, there's basically no one who's still progression-free. So that's the first progression. That's the first survival curve in the model. Now, the second survival curve in the model, this one, is overall survival. So this is generated from a bunch of data about when people died. right? So this represents deaths. This is a survival curve representing overall survival. And at time 0, everyone's alive. And by the time you get out to year 30, you're down to, 18 or 20% are alive. So obviously these are going to drop with time. As time goes by, people are going to get sicker with this disease and die. Now, what this overall survival curve here doesn't imply any difference between progression-free and post-progression. It just delineates between alive and dead. However, the alive part is broken down into 2 pieces by this progression-free survival curve. So you actually end up with 3 states. Your progression-free here, your post-progression here, which is they're still alive, but they're after the progression. And then, of course, when you get up here, now they're dead. And that so the regression analysis that came from those data points about progressions that occurred for your patients and deaths that occurred for your patients have now defined state membership into progression-free, post-progression, and dead. And that's just the general concept of the technique and a brief discussion of how that's represented in TreeAge Pro. I'm going to just see if there's any questions. Yeah, will this be available for microsimulation? Actually, no, it won't be, and it never will be, because the whole technique is based on average and cohort level data. Microsimulation just doesn't apply in this realm, and it's not appropriate under these conditions. So it'll never be represented in the it'll never allow microsimulation to occur. And then another question was, where does this come from? It comes from the same model. We'll run this later actively, but I ran the survival curve on this model, and this is the graph that came. So see, it's from the Partitioned example model. So this is the model, this is a survival curve. They're the same model. Okay, so now I'll continue with my next part, and now we'll go into the details of how you actually create this. So I'm just going to close this for now. And again, this model is right here from the files view here. Sometimes these get out of date when people update their software. If you want to recreate these, you just go to File, Projects, Recreate Tutorial Examples, and it will refresh all these example models. So now let's get into a little bit more of the details. So this is the the Partitioned Survival node. And at that, we need to use the view Partitioned info to define important things about this model. Now, in other models, there'd be a decision node back here to examine different strategies. So here's an example of that. And this is more typically what you'd have, a decision node and then partition survival nodes for each of the 2 strategies. I'm not really worrying about strategy selection right now. I just want to focus on one partition survival model and how it works. So the first thing you have to do is and now there's parameters and stuff, but that's typical to all models. But specific to the Partitioned model is you have to define some critical information. The survival time unit, that's really critical. That's basically telling me the time units used in these survival functions. So these are distributions based on years, survival against time measured in years. So I'm going to use annual here. It could have been monthly. I could change it to monthly. I'm not going to do that. And that's really important, that time unit here. And it's related to the survival functions. The time report unit is less important. That's just a reporting option. When we look, and we'll look at that report shortly, and I wanted to get those time units just for the report in months. So I set to that. Now this is really important. 30 years, that basically says, how long do I want this to run? And you saw that in the graph that I just closed. It ran for 30 years. That's my overall period under which I'm going to study the patients with this model. And then crossovers, that has to do with when you have curves that cross over, because you can't really be progression free and dead at the same time. That should not happen. If your survival curves and survival functions are accurate, that will never happen. But if there's small flaws in the survival curves and there's little tiny crossovers, you could just say, you know what, the flaw is so small, I'm just going to treat them as the least healthy state and let it run and not worry about the difference. But typically you'll leave this as stop analysis and actually stop the model from running if you get a crossover. Now let's continue on to the next piece. So now we get to the survival curve, the top one, the progression-free survival curve. And you'll notice there's some important information. The state, right? There's a subtle difference between the survival curve and the state, but this progression-free state says the area directly under this curve represents progression-free, whereas the area just directly under the overall survival represents the post-progression state. It also includes the pre-progression, but we have the other survival curve to break that up. And then dead, we don't need it. We don't need a dead down here. That's implied. Once you get past the overall survival curve, down here, there's an implied dead state that we saw in the curves. Now, that's pretty simple. The states, we just add the nodes and put in the states. What's more complicated is the survival functions. That's where really the bulk of the analysis and work needs to be done. And a lot of that has to be done outside TreeAge Pro. It's regression analysis, SAS data, it's biostatistics kind of work as opposed to modeling kind of work. So we're presuming that it's already been done, and we have the survival function defined as a distribution. So if you look at the survive PF variable here, it's using a survival function based on this distribution. So let's look at this distribution. Here's my dist serve prog free. And if I look at it, I see it's a Weibull distribution. And that Weibull distribution represents when the events occur. So more of these progressions are happening earlier and fewer of those progressions are happening later. So this, if I sampled this distribution, I would get something that looks very much like this. However, what I actually need for this kind of modeling technique is the inverse of this cumulative probability. So what this cumulative probability says is basically at time 0, no one has progressed. At time 5, something like 60 or 70%, 60% or so have progressed. And by time 18,444, almost everyone has progressed. This is the event happening. The 1 minus this is the number of people who have not yet progressed. And that's why the survival curve is kind of more shaped similar to this. It's really 1 minus this. So the distribution actually yields time to progression for different patients. But when we use it in our partition survival analysis, and this isn't just us, if you built in other software, it would be a similar thing. We want the people who have not progressed yet. So this dist serve function converts that from how many people have had it happen to how many people have not have it happen, and that generates the value that looks like this, right? These are the people who have not yet progressed. So there's a little bit of kind of transformation of the values that is common regardless of the software you use. We try to make it as easy as possible, where the distribution represents the time to event, and when it's converted to survival, it says how many people have not yet progressed. And you see by the time you get to 30, almost no one has failed to progress by then. Okay, so let's get back here. That's survival functions. Now, and we had a Weibull distribution. We actually have a Weibull distribution for each of the two overall survival, but there's not a lot more to learn from that. It just happens to be a different distribution, and it's longer time till people all die, 55 years before almost everyone's dead. And that makes sense, right? Progression is going to happen faster than death. So that's our survival functions here and here. A couple more notes on this. You can also use the Kaplan-Meier data directly. So in this case, I've got tables that contain the times to event, or the survive, actually the people who haven't had the event yet, and that's all contained in a table. And you can use the direct Kaplan-Meier data that way. And in this model, I've got it in both. I've got a table for each. That's fine. It doesn't change the technique significantly. It's just a different way of measuring survival. And there's also an option here, hazard, where instead of using a survival function, you can use a hazard function. So I think it's on this one. You saw, sorry, it's this one. Down here. You see, I have it set up to use a hazard function instead of a survival function, because sometimes that's useful. Sometimes people want to use their hazard functions. There's some techniques you can use for like relative risk and things like that that fit nicely into hazard functions, much harder to do with a distribution. So you may at some point have the need to use a hazard function, so we added it in. And in essence, this model basically has hazard functions that are representing the identical this value right here, that's just the Weibull distribution hazard function. That has two different representations. Is a distribution, as a hazard function. We did it both ways, and if you run rankings on this, you see the results are basically identical. So I'm just that model is really just showing you that they're equivalent. You can do it either way. Now let's get back to the model that we're interested in, that we're studying. And now we have our states, right, that are here, progression-free, post-progression, and dead. And now we have the state membership, but we need to accumulate cost and effectiveness, right? There's no value to this model if we can't measure the elements that we need to actually compare strategies. What is the average cost per patient? What is the average qualities per patient over these 30 years? So that's where we start to add in the values. So if I go to the node, and again, this is representing the progression-free state. I go back to the Partitioned info view. You see there's actually a whole bunch of different ways to represent either cost or effectiveness. Startup is just accumulated at the initial start of the model. So for example, if you had surgery that occurred before you start into some kind of medication treatment, you'd put the cost of the surgery right here, right? It's a one-time thing right at the beginning, right? Continuous, that's typically used for utilities, right? In fact, it could be used for cost as well, but definitely for utilities. It's just a continuous accumulation of utility to generate qualities over time, right? It's specifically just basically the area under the curve multiplied by the utility. The intervals is basically the same as continuous. It just gives you the ability to break that overall time period into individual intervals within that time period to apply, let's say, one utility for the first 10 years and a different utility for the next 10 years, just because they're older or whatever. So that's a one thing that you can do with is break down that continuous over time. And discrete times is something that we did implement in this model. That's chemo, right? So we're basically saying you get the chemo once a month for the first 6 months, starting with time 0. And that's applied at a specific time. So rather than it being kind of continuous, it's saying at this time, whoever's still in the progression free got the chemo. And then at 1 month, which is only about like right here, whoever's still in progression free got the chemo. So it's not aggregated or interpolated over time. It's at the specific time, whoever's in this state gets this cost. And chemo is such a big cost, averaging it out over time doesn't necessarily make sense. It really should be paid, because if someone dies tomorrow, they still paid for the chemo today. So that's why we have a chemo in this example as a discrete times. The other ones, the last one is exit. So this is for when you exit a state. So if we put something on the progression free, it could be the cost of progression. If we put it on the overall survival, it could be the cost of death. So it's as you leave the state, is that something that needs to be, is there a cost associated with that? So that's your different ways of accumulating value. And you can see I have discrete time, costs in this state, continuous utility, both continuous cost and utility for the second state, the post-progression state. And of course, dead has no cost or utility, other than potentially the cost of death, which I could have put right here, or excuse me, right here. So that's how you accumulate value. And you see there's not a lot of elements to do this. There's time that needs to be spent in terms of understanding what is happening, but the actual nuts and bolts of putting the data in, there's not that much to do. The hardest part is figuring out what these survival curves are. So now it's time to run it. Now I know we've generated a survival curve again, but I want to do it a little bit more slowly so that it's easier, so you can follow a little better. Right here, I select the Partitioned node. I go to analysis. There's 4 different options here. If I do the survival curve, it just graphs out the survival curves based on the survival functions that we discussed earlier. We've seen this before, so I'm not going to spend a lot of time on that one. So I'll go ahead. I might just leave it open in case I want to refer back to it. And now let's start to look at the other reports. Analysis, Partitioned Survival, State Report. And what this does is it tells you the total cost and effectiveness generated over the entire 30 years, right? So over the 30 years, about 5 years was spent in the progression-free state, right? That's this area here. This is about 5 out of the 30 years under this curve. About 10 years was in the post-progression state. That's this area in between the curves. And about 15 years was in the dead state. That's up here, right? That makes sense. This is almost a triangle. So here's your dead state, half the time. Here's the progression-free or post-progression. That's, you know, half of the remaining alive time, or actually 2/3 of the alive time, and this is the last third of the alive time. So that's the breakdown of the area under the curve, and this is the cost that was generated by that state as people progress through that. Now, it's a pretty big cost because there were basically $600,000 payments for chemo. But if you think about the first 6 months, almost everyone in the first 6 months, which is way up here, right, was still in the progression-free state. So you got almost to 600,000. So these reports are trying to help you understand where the data came from, and help you validate that you've entered the values correctly. Now, this kind of makes sense. If you spent 5 years, the utility wasn't quite 1, so you got a little less than 5 years of utility. And then the utility was even lower for the progression, post-progression. So the 10 years, you only got 7 qualies for those 10 years spent in the post-progression state. And of course, dead, you get nothing. So for a total of 600 average cost per patient of 678,000 and 11.67 qualies. That's what you're getting from this model as its kind of final, most important outputs. But obviously, there's a whole lot of calculations. Really, since it's continuous, it's almost millions of calculations that went into deriving these two primary outputs from the model. Let me just check and see if there's any questions. Can you go from PFS to death? That's a really good question. Yes, you can. There is no. It's easier to look at this one. There's really no. Just because you passed over this, you might have gone directly from here. So you could go right from there. It's not, the modeling technique doesn't really say exactly what happened. All we know is there are more people dead, and some of them may have come from. Most of them probably came from here, but a few of them may have come from here. So yes, you can, and it's implicit in the model, but it's not explicit the way it would be in a Markov model. A couple more questions. What if your survival model is non-parametric, Kaplan-Meier? Yes, we covered that you can put the Kaplan-Meier in there directly if you want to. I think that covers the question, so I'll go ahead and continue with the next report. So there's your state report. That's maybe not good enough to validate your model. So you could also run the time report, which I have it set up for monthly. You can see it down at the bottom of the screen. And that just breaks down that entire 30 years into months, starting at time 0, ending at 1 month. That's just a fraction for 1/12 of a year, all the way to the very last month from, 29 and 11 months, 29 years, 11 months to the final 30th year. And you can see with time, right? You start with more people in the progression free. Start with everyone. Now it's down to this. Now it's lower. Now it's lower, and it's getting lower. And by the time you get to 30 years, right, there's almost no one left progression free. Not 0, but really close to 0. And you'll see the percentage of the people in the post-progression state will go up and up and up, but then it'll start to fall. And the dead is just going to continue to rise. And by the time you get to the end of 30 years, 83% of your cohort is dead. In addition, across each of those months, you can see how much cost was accumulated. Here's your $100,000 chemo cost because everyone was in progression free. And a few people, even in that first month, have actually moved on to the post-progression and started to accumulate continuous costs in the post-progression state. And this is all the same thing from the state report, except just for 1 month. And when we get down to the bottom, you get the same 678,000, 11.607 that you saw, 11.67, excuse me, that you saw here as the summary. So we try to give you the reports that show you kind of the whole picture, and then that whole picture broken down into months or years, depending on your preference. Okay, that's that report. Now, that's just, we spent a lot of time talking about this. I now want to return to that decision model, because and here we just basically have the exact same model we just looked at cloned here. And the only difference between the two strategies is the cost of the chemo is higher in the second strategy, and there's a different survival function for the SERV-PF. We use the same OS curve, which probably doesn't make a lot of sense, but we just wanted to minimize the differences between the strategies for tutorial purposes. But the survival function is different. It uses one distribution for the first strategy, a different one for this one. So now we actually have differences between the strategies, and now we can do things like run rankings. And you see, here's the one we looked at in detail. Here's the one we didn't look in detail, but it's almost the same. We have an incremental cost, an incremental effectiveness, and an ICER. And depending on your willingness to pay, let's say your willingness to pay was 50,000, then you would use treatment. You would choose treatment 1 as most cost effective. If your willingness to pay was 100,000, you'd choose treatment 2 as most cost effective. This is just standard cost effectiveness analysis that you've all done before in TreeAge Pro. So there's nothing there. I just wanted to kind of bring that full circle with the kinds of decision analysis problems that you are likely to look at. And then the last thing I'll do today is I'll run a tornado diagram on this. And all I did was adjust all these parameters up and down by 5%. I didn't try to get fancy with what the intervals were. I just adjusted them up and down 5%, generate the tornado. And we'll look at the ICER tornado specifically. And you see how those particular parameters affected the value. You notice the rate OS didn't have any impact. But as this chemo for treatment 2 goes up, that increases the ICER. As chemo 1 goes up, that decreases the ICER, et cetera, et cetera. And these two led to a difference in strategy, right? 50,000, this changed the ICER from being below to above, and this one from above to below. And if you ever want details on the tornado, you can just come over here and it shows you the threshold point where the strategy has changed. So I just wanted to bring that kind of back around to, yes, you might be doing a Partitioned model, but you still need to be doing decision analysis. You still need to be doing sensitivity analysis and all these other things. I didn't do probabilistic sensitivity analysis on the model just in the interest of time, but you certainly could do that as well. One more thing to show. I'm going to go back to the original model here. Here's a little trick. If I just right click on this, I can close all the tabs to the right. Just close all that report output. And I want to show another technique, which is if I right click on this, I can convert this to a Markov model. So if you decide, for example, that that the Partitioned model is not good enough because it doesn't account for backflows, or there are important events that I need to count, or they have costs associated with them, you may decide, okay, my model's too complicated to use a Partitioned model for, so I need to convert it to a Markov. So I'm going to choose the complex, which tries to match the Partitioned. Now it generates some very complicated formulas. If you're actually going to use this, I would actually use the simple instead, which is less complicated formulas, because you know you're going to modify it after the conversion. But I'll use the complex. And what you end up with is the same distributions and these really complicated formulas trying to recreate the survival curves that you have. And if I go ahead and run the Markov cohort analysis on this, I'm going to be getting very similar results. And if I generate a Partitioned curve from the Markov, you'll see it should be very similar. It won't be exact, but it should be very similar to the survival curves you get from Partitioned. So here's the one directly from the Partitioned. Here's the one from the converted Markov, and you see they're almost identical. You got this one little delay because you don't have anyone going directly from in this Markov model. You don't have anyone going directly from PFS, progression-free, to dead, which is not very realistic, but this is the best recreation of that. However, you would definitely want to come in here and start to look at this model and make it more realistic, that it's not realistic to have no one dying here, right? This needs to change. And as this changes, you're going to have to massage some of these to make it as accurate as possible. So you can convert this a Partitioned model to a Markov, but that's not the end of your story. You have work to do to make it as accurate as you can. I think that's it for what I wanted to talk about today. I'm going to go back and see Could you include age-specific death rates unrelated to cancer in this model? That's a good question. I think you could, because everything has to be at a cohort level. So you would have to have a common age for your whole cohort. And this would have to be included or integrated into your survival functions. I'm not exactly sure how you would do that, but I don't see any reason why you couldn't have a more complicated survival function that did account for age-specific death rates. Now, that being said, I don't think you would need to do that, because ultimately the curves here would have come from data that should have already included the age-specific death rates. So I don't think you'd necessarily want to adjust those any further than what came from the original data, but you could if you wanted to. So I'm going to just hold to see if there's any more questions before we end for today. Okay. One other thing that my colleague was listening mentioned, if you really did want to run microsimulation, you certainly could run microsimulation on this Markov model. So if part of why you might have converted from a Partitioned model to a Markov model might have been because you wanted to do simulation, and you could absolutely do microsimulation on this. But again, you have to adjust these probabilities. You can't assume that they're correct. So I guess that's it. I'm going to leave you all today. We will. Is there documentation? Absolutely. If I go over here and just do a search on partitioned survival, and there's a whole chapter on this. And I think we even use the same model. So definitely you can go through this, and this will talk to you about what you enter and where you enter it, and in longer detail. Okay, so with that, I think we're done. So I'm going to close the meeting. Thank you all for joining me today. Appreciate your time, and you can expect this to be posted within the next few days. Thank you.